Taiwan, you have patients as a part of their panels taking reimbursement decisions around rare disease drugs. Or another example of rare disease patient engagement I can give you is the work that Deborah itself is doing. We at the patient level are not only working with clinicians in Singapore, clinicians and researchers. So we've helped to successfully initiate 2 clinical trials around EB drugs in Singapore. Or we have, currently we are part of a research process around collecting data on quality of life and socioeconomic burden of living with rare skin disorders. Or to go beyond maybe the national or regional level, let me give you a great example around the work that we're doing with our international organizations, such as with Rare Diseases International. I'm really proud to draw attention to the MOU that Rare Diseases International has signed with the WHO. This is the first ever collaboration of the WHO with a community, with a patient community organization. And through this partnership, we aim to shape international rare disease policy and strengthen the capacity of health systems to address rare diseases.
There are many examples among patient groups which are members of UICC. We have particularly 2 programs where we work with patient groups in this respect. First, Cancer Advocates Program. So we have a full capacity building program around building advocacy for cancer prevention and control. And we work with sometimes grassroots patient groups like Cancer Survivors Malaysia, which works at the local level, and really trying to develop their strategy in order to make good advocacy at various levels. But also we have other examples like PAPO, the Philippine Alliance of Patient Organizations, which is this really well embedded the whole ecosystem around cancer control.
So that is just starting in Japan. So we discuss with the pharmaceutical company or researcher and also patient. So where the treatment is coming and how to send our voice, patient voice, and also the citizen and caregiver's voice. We set those platforms and discuss about how to continue this very good sustain healthcare system in Japan, how to continue and how to support and how to progress this system in Japan. We're talking about it every month.
In Singhealth Patient Advocacy Network span, as I mentioned, we started about 4 to 5 years ago, and this whole area of patient advocacy in Singapore is a greenfield 5 years ago. And I think we were fortunate in the sense that we had the right people in at the right time. First of all, I would say that we have leaders within Singhealth who believed in this and wanted to invest in it. Not invest in just in terms of money or all that, but really invest in the time and effort to get it going. Then we have within to get this going, there is a guiding coalition of certain partners within Singhealth itself that came together to grow this. I think you need to partner with the healthcare professionals, the healthcare teams within your system. So in this case, the leaders of the organization decided that's what they want. They got in a guiding coalition comprising of the Institute of Patient and Safety and Quality. Then we brought in the Office of Patient Experience as well as nursing, group nursing. So these are the people whom you know would usually be very much involved in patient engagement work. So they came together and gave to try to build this and partner this to grow the patient advocacy itself in Singhealth.
We're part of technical working groups. We patiently attend most of when we are invited by the Department of Health, the field health. We sit at the table and we present the patient's point of view. So sometimes, when we talk amongst ourselves and we say, are we really being listened to? I mean, is our presence really being valued? Sometimes we get so frustrated because it just keeps going on and on and on. But, we comfort ourselves, the patient leaders. We're saying, let's just keep our presence felt, because there will come a time when, let's say, there's a new leadership or when there is a policy, then they know that there's already a patient group that they can go to. Let's just be there. Let's just persevere and make our presence felt. And someday we will be valued for who we are.
There's still more to be done in terms of competency building for our own patient advocates, recruiting more of them, because we need a diversity of voices, right? From all age groups, all backgrounds, as well as medical conditions. So we need to be able to recruit more people so that we hear diverse voices. And together with that, we need to continue to grow their skills and knowledge so that they can contribute towards this conversation and partnerships with the healthcare teams. There's also the third area of research. In healthcare, we always talk about evidence, right? So it is equally important to show the evidence of, does all these things work to improve healthcare? So I hope we can create more research to show how patient engagement and patient advocacy can contribute to better health outcomes.
I think in people's minds, the one thing that needs to be borne in mind is that phrase that I keep on going back to, which is people have been affected by life-changing health conditions, injury or disability, which is a phrase I'd prefer to use than patient or consumer, if you like. A bit more long-winded, but I'm sure we can find an acronym for it. That we bring jewels of wisdom and insight from the caves of suffering. And once you take an asset-based approach to individuals, as we should do to communities, so it comes straight from community development thinking. Once you do that, your mindset changes, because then you think, actually, this isn't just focus group fodder. This is, let's bring people to the table. Let's forget about representation. Let's find ways of being with each other. And that's the STEM. Structurally, I'm very keen on a model that we've developed in my own service, whereby I am what's called a patient director. It's an executive role, commensurate with the clinical and managing directors. I have an operational portfolio and of patient public involvement and experience and the like. But what I have is a pool of paid, supported and trained patient partners.
I think from the government side, the institutionalization of having patient groups in the table or have a seat in the table, it should happen, because right now it's only by invitation. It's not a policy yet. That in our HTA, I'm glad to say, in our health technology assessment, it is there that it has to have, they need to consult patient groups, and in clinical trials, now we're getting invitations that patient groups have to be there. So it's getting there, but we want it as much as possible in all the departments of the Department of Health and even in Congress, and even in FDA,
I think there are three things I would point to. One is, I think, creating these safe spaces where patients feel that they can really interact, they can ask questions, where they're empowered to really be curious about what's going on and to ask difficult questions of their providers. So having that space and platform in a very structured way, I think is really important, where patients feel like they can reach out to appropriate resources and be informed in a credible way. The second thing I think is really important is to create champions for patients that reflect themselves. And so very often we see that there's a cultural sort of mindset change that needs to take place, where patients may feel that, it's the doctor's role, it's the specialist role, they're the expert, I'm not the expert. And actually to be able to see visibly champions that they can relate to and that they can connect with, I think is really important. And I think the third thing, especially in situations where, again, it's been a very particular type of doctor-patient interaction, is that we actually need to teach people these tools, how to have dialogues, how to negotiate, literally sometimes how to speak to power and feel confident in themselves. I think all of that is really important. So these three things, I think building spaces, having champions and giving people those tools of communication, all these three things I think we can work on together.
Healthcare system is very important, but on the other side, we want to progress new drug and new treatment. So that is a key point is clinical trials. But those clinical trials, before that, we cannot send our voice and share our experience. So participated in the clinical trials. But now we discuss about how am I feeling so attending the clinical trials, or where is it difficult to access for clinical trials? So we're talking about those issues in Japan. Now we sit on those platforms.
What more can be done is, if I can just continue from my previous response, it's to go beyond these token representations that might be happening in some parts of the world, of simply giving patients a designation or a seat at a table. But then I think as a next step, we need to take their opinions seriously. Patients should have the right and should have the voice in decision-making around research priorities in healthcare, on reimbursement of drugs and devices for rare disorders, in even the kind of healthcare system that they want to see. What kind of healthcare professionals do they want access to? Do they really want a clinician or an expert, or do they want community nurses? Do they prefer care in a hospital or clinic, or do they prefer home care? So these are aspects that really make a difference to patients, and listening to them, giving them a voice, empowers them and translates into positive outcomes.
At CAPE, I think our main objective is to see patients as partners for sustainable health systems. There's so much that actually needs to be done to enhance patient engagement in our region. But for us, there are three priorities for now. The first is really shifting organizational cultures in the health system, as well as professional mindsets, to really embrace a patient-centric approach. The second priority is really to encourage and promote institutionalization of patient engagement through formal engagements, formal platforms, as well as policies. Our third area of focus is really the oil that drives the wheels of all this, which is really patient experience data. We need to better harness the rich data that patients give us from their experiences in a structured way so that it can be incorporated into health system decision-making. So these are the three areas we're working in CAPE, and we hope that you will join us at the Roundtable and in all our work in the coming year.